Let us get to our order of business for today. I'm very excited to have Helen Tome here with us. She's the director for the Ely Community Health Center, and she's going to be talking about the free medical and dental services with a particular emphasis on the dental services. So let's welcome Helen.
Hello. As mentioned, my name is Helen. I am the executive director and dental innovator for Ely Community Health Center. I did bring with me our volunteer registered dental hygienist, Peggy. She's going to jump in if there's questions that I'm not too sure how to answer. And she volunteers her time to provide direct care services to all of our patients. I've been with the organization since January of last year, and I'm very excited to be here and share some information with all of you about our programs and services. Here we go. So Ely Community Health Center is a nonprofit organization that was founded in 2015 after Project CARE ceased operations here in Ely. We've been offering medical services at no cost to those who are uninsured or underinsured through a group of volunteers, and have recently expanded our services to include dental care. And our mission is to provide affordable services with a vision to improve community health. Oops. So what does underinsured mean? People who are underinsured have insurance but cannot afford the deductibles, copays, or other out-of-pocket expenses that are common with most health insurance plans. Our organization does not bill health insurance for any of our services, but you can still receive care even if you have insurance. We are here to help those people that might not seek out care due to high out-of-pocket expenses. So what services do we offer? We provide management of chronic illnesses such as high blood pressure and diabetes. We can provide treatment for acute illnesses such as infections, non-emergent minor injuries. We offer referrals for ancillary services such as lab and x-ray. We have an agreement with Ely Bloomington Community Hospital to refer patients that need these services. The patient is able to go through their charity care process in order to set up an appointment to get those services at a reduced rate or at no cost at all. Prescriptions. This is a common service that we provide. Many of the patients that we see need a prescription refill, but don't want to incur the out-of-pocket expense of an office visit to get those prescriptions refilled. These are typically prescriptions for chronic diseases, and going without the needed medications can have a great impact on their health. Physicals and education. Many patients that come in for physicals need them for their employer at the outfitters in the area. And many of these patients are uninsured or do not have the means to pay the out-of-pocket expense that incur with a regular clinic visit. MNsure navigation services. This would include assistance in applying for state-funded public programs such as medical assistance and Minnesota Care. All of the uninsured patients we see are encouraged to go through this process, as most do end up qualifying for some type of financial assistance. And you do not need to be a patient to utilize the service. It is available to anyone who needs assistance in navigating the MNsure marketplace. Dental cleanings, tooth x-rays, and oral cancer screenings are all provided by our wonderful volunteer, Peggy Stoley, who is a registered dental hygienist. Referrals for more advanced dental care. This would include helping patients establish care with a dental provider if there are significant issues that need to be addressed, such as cavities, periodontal disease, and even teeth needing to be extracted. Referrals for other community resources. As part of the community care team, we are connected with other organizations that provide assistance with mental health, housing, and food insecurities. So what do our patient demographics look like? We collect data on all the patients that we serve. For 2022, 154 were new patients that had not been seen before. 55% were without access to health insurance. 70% were without access to dental care. 83% were below the federal poverty level, and 46% were seniors, which is classified as age 65 and older. There is no income limit in order to be seen at our clinic. Our services are available to anyone who is experiencing barriers to receiving care, and we don't turn anybody away. Oh, yeah. Oh, sorry about that. Okay, I'll be closer. No, that's okay. So there's no income limit in order to be seen at our clinic, and our services are available to anyone who is experiencing barriers to receiving care. We don't turn anybody away. If we're unable to treat the patient, we will work with that individual to find a solution. The majority of the patients that we see report being employed or on a fixed income, but are still unable to have their healthcare needs met. So what is the importance of oral health care? Oral health has been identified as one of the 10 leading health indicators by the Office of Disease Prevention and Health Promotion. Poor dental health can have serious consequences, and prevention needs to be at the front lines of rural oral health care. Poor oral health is associated with a number of chronic diseases, including diabetes, heart disease, and stroke. And most oral health conditions are largely preventable and can be treated in their early stages. So what are the barriers to oral health care that our community members are experiencing? Again, based on the data that we've collected for 2022 on the patients that we've seen, 57% of dental patients reported not being able to establish care with a dental provider. And this could be due to either the insurance that they carry or the dental provider's ability to take on new patients. 32% reported cost or insurance as a barrier to care, and 11% reported transportation as a barrier to care. So these numbers are based on data collected by our organization, but I also wanted to share some data from Ely Community Hospital. I've included a link to their website on this slide if anyone's interested in reading the full report. But according to a 2021 survey completed by EBCH as part of their community health needs assessment, 53% of respondents reported that access to dental services was one of the 3 most pressing health concerns in our community. 70% of those respondents reported dental care as one of the 3 largest gaps in healthcare services in our community. And as you may know, there's only one dental provider in Ely. This provider reports having over 1,000 individuals on their waiting list, which includes children, adults, and seniors. Limited access to oral health care is not only an issue here in Ely, but it is becoming a known issue throughout the state and even the country. So I did include a video here, and I did want to share it with you because I feel like it really gives a good insight into what is happening throughout the state. I won't show the whole thing, but I would encourage you at some point to go and watch the full video because it is really informative.
The card can feel bad, the chronically ill or underinsured. But there's a lesser known dilemma that we ignore at our peril: the crisis in oral health care. The current delivery model works very well for healthy, wealthy, compliant people, while failing low-income children and families, older adults, and people with special needs. The harsh reality is that Minnesota ranks near the bottom of states for rates of Medicaid reimbursement. As a result, many Minnesotans can't find a dentist that will treat them. But there is cause for hope. Minnesota has a dedicated network of critical access dental providers, finding innovative ways to expand care while reducing costs. They stand ready to meet Minnesota's needs, but need targeted state investments to improve dental health. What would it take to make dentistry painless for all Minnesotans?
Good morning, Apple Tree Dental. We're all right, you keep it clean.
Apple Tree Dental is one of the nonprofit critical access dental providers whose mission is to help uninsured or underinsured Minnesotans overcome barriers to care.
Really, really clean?
It's, it's really just dentistry, but it's dentistry for a different population. It's dentistry for people who have access challenges.
Hi.
who have special needs and sometimes just financial barriers. It's still dentistry, it's still caring for people.
Without Apple Tree being here, there'd be a lot of people that would just be kicked right to the wayside.
Apple Tree has 8 centers throughout Minnesota, including 6 in greater Minnesota and 2 in the Twin Cities area.
We not only serve patients that come into our clinics, which is what most people probably imagine, but we also have teams that go out using mobile delivery systems and telehealth. Then they go out to places where people that really need dental care but can't get it. Where they live, like in nursing homes, Head Start centers, schools. Or we can reach people that struggle to get the dental care.
When you look at surveys from people as to why they don't go to the dentist, finances is the #1 issue.
When you start talking about going to the dentist and you have to wait 2 months to get in to see a dentist, I mean, like, what's more important? You know, my teeth or my house? You know, my teeth or some food, you know what I mean?
Disease hits for low-income families. It's their ability to get healthcare insurance and whether that insurance will be accepted by a dentist.
For people who get their dental coverage through Medicaid, they have to limit themselves to going to Medicaid participating providers. Very few dentists participate in Medicaid because often Medicaid pays much lower rates than what the dentist typically charges for services.
Less than 40% of all dentists nationwide are willing to accept Medicaid patients because of the low reimbursement that they receive for those services.
Here in Minnesota, a state known for its medical technology and care, you might expect the rate to be higher. But Minnesota's Medicaid reimbursement rate puts it consistently among the very lowest of the 50 states.
Providers are paid poorly. And unfortunately, that does lead to many dental providers making the hard decision to either participate or not participate in the public assistance program. And that leads to an access to care issue, and providers aren't readily stepping up because of the economics involved.
2/3 of Minnesota dentists participate in a Medicaid dental program, even though it costs them on average more than $30,000 to do so. A visit to Fergus Falls, Minnesota illustrates how critical access dental providers like Apple Tree are collaborating with rural communities to solve this problem.
Hi, I'm here for Karma. Need to get her set up with another appointment.
The Fergus Falls Clinic provides an essential service to the community. There are more than 1,000 names on a waiting list to be seen here.
Fergus Falls is really typical of a lot of rural communities in Minnesota in that it has an aging population struggling to get care. And recent immigrants that are working there, as well as a lot of low-income people that live in the community that depend on medical assistance for their health care.
I get disability and SSI. When you're living on $700 and some a month and have to pay everything, you need to have a place where you can go and get treated.
Here, you can be here.
The Fergus Falls Clinic is typical of Apple Tree's approach, both in the population served and in how the clinic got its start.
The story is always the same. There was a leader in that community that knew that access to dental care was a big problem.
In Fergus Falls, that person was Diane Thorson.
Diane Thorson, in her role as Director of Public Health, was really aware of the public health needs in that community.
We identified many different needs, one of which was lack of access to dental care. We've heard so many stories, of the 1-year-olds that are already having many cavities. They're painful.
They do send a hygienist to Ely once per month, but they have yet to send a dentist or a dental therapist to Ely. So you can still get the preventative care through Children's Dental Services, but if you need to see a dentist, you're still traveling quite a ways. The nearest Apple Tree Dental is located in Fergus Falls, which is over 200 miles away. So a priority goal is to recruit a dentist or a pool of dentists that would be willing to travel to our facility once per month or bi-monthly to provide more advanced care, such as restorations and extractions. We're hoping to find an individual that would enjoy spending time on the lakes and all the other great things that we have to offer here in Ely. So if you know anyone, let me know. We are exploring our options for billing state-funded insurances like medical assistance and Minnesota Care in order to sustain our program. This revenue source would help cover the cost of supplies and would fund the staffing if we were able to find some dental professionals that would be willing to travel to our facility. Next slide, let's see if I can get it. Sorry. Oh. So how can you support us? Volunteering is a great way to support our cause. We have both licensed and unlicensed volunteers that participate with our programs, so no experience required. Even if you can only commit to once or twice per year, we'd be happy to have you. Promoting our services. There are so many people that I have run into that say, I didn't even know there was a free clinic in Ely. So talking about our services to your friends and neighbors or at church and just spreading the word that we're here is huge. We want to make sure the people that need us know where to find us and how to access our services. And then donating financial support is essential to the success of our programs since we don't charge any fees. All monetary donations are 100% tax deductible and go directly towards supporting our programs and services. And donated supplies are always welcome as well. So I've included a couple links here, one to our website and one to our capital campaign. And I've got one more slide. Just one more. And it's all of our contact information, phone number, email, address, all that good stuff. So if you have questions or need to get in touch with us, here it is. And that's really all I have for the presentation. And I'd love to hear any questions that you guys might have. Yeah, go ahead. The question is, what is dental therapy? And a dental therapist is similar to a dentist. I think it's like a step below as far as their degree goes. Is that right, Peggy? So they can still do cavities and yeah.
Children's Dental Services has a dental therapist that comes to Chisholm a couple times a month, and that's sometimes who we can refer to if patients need a phone. But they haven't come to me. It's kind of a new field. Oh, yeah, a dental therapist is kind of like a nurse practitioner in the dental field. They're not truly a dentist, but they're one step above what I can do. I can't do fillings. I can just do cleanings and x-rays and fly treatments, but a dental therapist has one step up. And there is a dental therapist who goes to Chisholm twice a month and takes care of some of our patients and also Duluth, right, through Children's Dental Services. But that's been our biggest hurdle, is trying to find somebody to restore patients' teeth. Just about everybody I see has a need. And we do a lot of calling around. We've been also fortunate that Dr. Yudovich has taken some of our emergency patients. But as we all know, he's kind of ready to retire. Dr. Chop is also available on a very limited basis to see some of our emergencies, but I do work underneath her license, so we're very grateful for her, and she appreciates us taking care of some of the patients that she's not able to see. So we get a lot of referrals from her too. Dr. Gregorich, who some of you might be familiar with, has also joined our team. He's another collaborating dentist. And if people are able to go to Duluth, he will always take new patients to take care of immediate needs too. So it's getting better. It's getting better all the time. I just wish we could recruit somebody to come to Ely.
Why is that so?
To get somebody to come to Ely. I think just because there's such a shortage of dentists overall. That was kind of our thought. If we could entice somebody to come here, we have them stay, Grand Ely Lodge, get them like a little excursions, kind of wine and dine them a little bit, and maybe they could do dentistry on Friday and then have the weekend. But we just haven't found the person yet. We're working on it. Yeah. It would have to be, yeah, volunteer.
Well, for now, I mean,
Yeah,
we're
hoping to
looking
get
at,
funds to pay.
Yeah.
We thought we'd offer 800 to 1,000 a day if they would come. And then give them some free accommodations, so, but we're still in the works.
and that's part of why we're exploring the options for billing the state funded programs too.
Yeah,
Because we could use that revenue source. For billing medical assistants or Minnesota Care, we could use that revenue source to entice some professionals to come to Ely.
yeah, I think that we were looked into, say cleaning costs, say $100 when you go to the dentist. I think Medicaid only reimburses 18 of that. That's one reason the dentists don't really want to sign up. You know, they can't cover, they're losing money. But for us, that would be perfect because that covers all of our disposables and some of our electric bill. The other thing that we've done is we've actually rented out 2 of our operatories to outside sources. We have a massage therapist. Her name is Laura Schultz, who's renting space, and she does, of course, massages as her business. And we just recently signed a contract with
Lakeview Behavioral Health. They're gonna do telehealth, mental health services in that other room. They're not set up yet, but they'll be in a couple months, I think.
yeah. So that's really awesome. That gives us $500 a month of income, just renting out rooms that we're not using presently. So that's really good. Anything else? No,
No,
No.
the places that are renting their own space, they are doing their own business. Any other questions?
We're just so lucky to have Dr. Anderson's building.
Yes.
That was a miracle. We were looking at building out at the senior center. It would have cost so much more money with all the things we would have had to add. The plumbing and the electrical and the separate rooms. It was such a blessing that he basically lowered his price so we could get that building. And it's so awesome. Yeah.
How many people are on?
So the question is, how many people are on our board? And I believe there are 7. We have Mary Bianco is our board chair. And she is a physician here in Ely, and I think she also practices in Virginia and in Hibbing. And then we also have Christine Mosier, who is a CNP, and again practices in Virginia mostly. Tom Omerza from Franson Bank is our board treasurer. We have Marcia Chambers. She is she works at Vermilion. I can't remember the new name. It's not Vermilion Community College anymore, but up north, whatever it is. And then we also have Molly. She is also at BCC. And then Crystal Chop is part of our board as well. And Andy McKibben, he is a retired medical doctor. I don't think I'm missing anybody. I think that's it. Yeah. And we have discussed recently on expanding our board because this project has kind of taken on a life of its own, and it's growing exponentially. And we've gotten some good footing going now with this new building and being able to actually provide services on a regular basis. Yeah.
I guess other than we start talking, what are the medical services you provide that are not dental?
So the question is, what are the medical services that we provide? We provide very basic medical services. So we can help manage chronic diseases. We can help manage their prescriptions. A lot of the patients that we see do come in for a prescription refill. A lot of them do have insurance, but they only want a prescription refill. They don't really necessarily want to incur all the costs of having a regular clinic visit. We can treat minor injuries and illnesses. We offer MNsure navigation services. I'm a certified MNsure navigator. You do not have to be a patient to utilize that service if you're needing help managing or navigating the MNsure marketplace. I know that can be a really difficult thing to get through. So I can help with that. Yeah, so very basic. We can make referrals for lab and x-ray services. We don't have the capacity to do that ourselves at our facility. But we do have a agreement set up with Ely Community Hospital where we can refer the patients to them and they help them go through their charity care application in order to get those services. And part of the charity care application is you have to show that you don't qualify for medical assistance or Minnesota Care. So it's been really beneficial to have the MNsure navigation services right there to help with that process. Otherwise, it can take, weeks to get in and get that service done.
If you wanted to touch on your grant.
So Peggy thinks I should talk about grant writing. I am new to the nonprofit world. I was previously employed at Boundary Waters Care Center and I did all their insurance billing and admissions and that kind of fun stuff for about 12 years. So I'm very new to this and it has been extremely rewarding to go through the process. We have applied for several grants. We've been awarded a few. There are a few that are still pending, but we do have a lot of grant requests out there to help support what we're trying to accomplish here in Ely. And it's looking very promising, I would say, that we're going to secure some of those grants to be able to help this program move forward. But we do need community support on top of that. I mean, it's a big project for us, so, yeah.
Since we have time, you grew up here and you went out to Poland, but
So the question is if I grew up here, and the answer is no, I'm a transplant. I grew up in southern Minnesota. My father owned a photography studio and him and my mother ran that for the majority of my childhood. And then we moved around a lot in southern Minnesota and he's now farming in south central Minnesota. I moved up here. I just planned to come for 2 years at the college, get my generals done, move on, and I completely fell in love with the area. I met my husband here. We have 2 kids, 10 and 13. So I've been here longer than I've been anywhere else in my entire life. So since about 2000, I think it was 2007, I moved up. Yeah.
Could you tell people a little bit about the volunteer positions if people are, available to help?
Yes, definitely. So the question is, what kind of volunteer positions do we have? Our medical clinic is where we utilize the majority of our volunteers. We have a receptionist that will greet patients when they come through the door and hand them the paperwork that we need. It's not a lot of paperwork, but we do try to collect data on the patients that we're seeing, mostly just to make sure that we are in line with what the community needs are and making sure that we are, meeting the need that is the most great in our community. And then we do have a triage volunteer, and that could be a nurse. It could be EMT, thank you. I was blanking on anybody with some clinical training, and that individual will see the patient first and get the vital signs, kind of get an idea of being seen, and help the physician with whatever they might need. And then we do have a medical provider, and this could be an MD, it could be a certified nurse practitioner, and that person then sees the patient and comes up with a treatment plan, does an evaluation, does a lot of follow-up to make sure that the patient received all the services that they required. And then at the end of the visit, I usually check in with that patient, especially if they don't have insurance, and just see if they need some help navigating that MNsure marketplace. Because the majority of patients we see do qualify for financial help. A lot of times they just don't know how to get there, or they, start the process and then it becomes cumbersome and they decide, oh, this isn't worth it. So we do check out with the patients and make sure that if there's any other services they could benefit from, that we help assist them in getting those. And the dental piece has been a big part of that. You know, we ask the patients that we see, do you need a cleaning? Have you been to the dentist? Are you having trouble getting into the dentist? And then we can help them on that end as well. And vice versa. We see patients at the dental clinic and we take their blood pressure. And if their blood pressure is high and they say, oh, well, I don't have insurance, or I don't have a refill on my medication, we can say, we provide that service on Thursday evenings, stop in and we can see what we can do for you. So it's really the medical dental integration has become a topic because those two things really do go hand in hand. Yeah.
Outpatient medical in particular, how do they find out about you? Are there referrals from the hospital or other physicians? Or word of mouth or the paper?
So the question is, how do patients find us? And that is a great question because it's something that I've been kind of focusing on since I started, because I didn't even know there was a free clinic in Ely until I saw a job posting for this position. So I've been working on updating our Facebook page. I know that doesn't reach all the demographic area, but it has helped a bit, I think. We did run ads in the paper all through 2022. I think a lot of it is word of mouth. And the physicians that we have volunteer at our clinic, the majority of them do work at the Essentia Health Clinic here in Ely. So I think we do get some referrals from that end as well. Being a part of the community care team has been huge. I don't know if you guys are familiar with the community care team, but it's a group in Ely that collaborate together we get together once a month and talk about what our agencies are doing. And it's a way to find resources and connect with everybody. And we do get some referrals from their care coordinators at Essentia. That has been a big source of referrals for us.
And college.
Yes, the college has been, we help a lot of the students up at the college. We see a lot of them for physicals. If they have insurance, we do encourage them to go be seen at the regular clinic. But a lot of them, come from out of state, and a lot of times that insurance piece gets tricky when you're coming from out of state. But they do need those physicals in order to participate in the sports programs. And yeah, I think they've utilized our services quite a bit.
The other thing, if you want to mention, is sealants that are going to come to Ely.
Oh yeah, do you want to talk about that? Because you know more about what's going on with that.
Okay. We partnered with Minnesota.
I think it's
but we have set aside a day in February 10th. And there's another outside organization who's going to come to the Ely schools to set up their portable equipment and offer sealants and cleanings and fluoride treatments right at the school. So I'm partnering with Kathy Champa, the school nurse, and we've got that all set up. So far, I don't think anybody's signed up, though. Isn't it amazing? I just don't know. We hope we get at least 10 kids. Yeah, we send home the flyers to every student through the school, and they're going to resend them, and then I put it on What's Up Ely. So they need to have at least 10 kids in order to come. So if you know anybody who you would like to share that information with, it's February the 10th. And there is a nominal fee. They bill insurance if most of our children have some sort of medical insurance to the state. But the highest fee that they would charge for all the services is $150, which is considerably less than it would be going to a dentist. So I do hope that there will be some parents that will take advantage of this program. Yeah, but that's another thing that we've organized. Last year I went into the school and I saw the K through 5 and showed them a little movie and showed them how to brush their teeth and gave them free toothbrushes. And then my mom was the tooth fairy for the 4th of July parade. Yeah, she was awesome. Maybe I can talk you into coming back this year to the kindergarten class. But all of this has really been fun. We do it because we love it. And I hope that more and more people will take advantage. Right now, I'm actually only booked about a month in advance. It's not too busy. I don't feel too overtaxed. I work 3 days a week. I start at 11, get done around 6, so it's good. But I do have 2 other hygienists in the works, who are interested in helping me when I get too busy. And we're hoping that will happen, yeah. We're so glad we have Helen. Really helps with all the background stuff that I'm not good at.
Wondering, how about if somebody wants to donate the money to the campaign? How do they, let's see, fill out the check? What do you write on the check? Oh, the money, yes, but.
So if you're interested in donating, there are a couple of different ways. We do have this online option, which isn't, great for everybody. But this is our capital campaign website. It gives you an option to make a donation online if you choose. If you would like to just send a check, you can write it out to Ely Community Health Center. And you can mail it to our office. It's 33 East Chapman Street. Yeah. Otherwise, our website too does have another, it's kind of hooked up to the same capital campaign here. But it does have an option to, again, go online. Yep, right down there. So a couple different ways. Are there any other questions? Thank you. Thank you so much for having us here. I do have to say, I'm not, this is probably the first time I've ever done public speaking, so it's a little nervous. Yeah.
Tell us about your kids. I see your names in the paper once in a while.
Oh, yes, my children. Ethan is my youngest. He just turned 10 on Christmas Eve. He's in the 4th grade. He is doing archery. That's been really fun for him. He's not one that's always been super involved in sports, so it's fun to find something that he's interested in. I don't know if you guys are aware, but it's really cool. They have this archery setup in the basement of the Napa building, and they just shoot arrows at targets all night, and it's great. And then my daughter Madeline, she's 13 and she's in 8th grade. She is really involved in figure skating. She's actually going to the Northland competition this weekend, so she's going to go compete. It's her first time ever. She's very nervous, but I'm sure she'll do great. She's pretty involved with volleyball too. So yeah, they're great kids, and they're at fun ages right now because they're old enough to kind of be independent, but are still doing a lot. Then my husband Brian, you might know him. He owns and operates the Boathouse Brew Pub, so he's always busy cooking food and doing that kind of stuff. But and he's been really busy with the project upstairs, so that's been really interesting in the past couple of years. So yeah, we're kind of a busy family, but this has really become my passion. I'm so excited to see where this whole project goes. It's been a really nice change of pace for me. I've been doing numbers and insurance for the majority of my adult working career, so this has been really an amazing shift for me, and I'm really enjoying it.